So hello everyone, here I am again with part 6 going into a father's journey with a son who has a seizure disorder. So I just wanted to start off real quick and say, as I do these videos, I'm realizing, things that the good Lord's bringing into my heart, hey, you forgot to say this or too much of that or whatever the case is. I'm finding more and more that I just keep bringing up more and more detail to this. So there's a lot of things I haven't covered, and there's some things I'm probably not going to cover that might not be as important. But anyhow, so moving forward here. So here we are in the hospital. He's about 11 years old, his first surgery. And after the doctors take him back into surgery to remove the grid, which I told you the last time, they put it on, they cut his medicine, they monitor him, and he didn't have any seizures for 7-8 days. So anyhow, they finally got enough seizures. He had grand mals, 4 or 5 of them. They put him back on meds. They calmed him down. So he's in the ER. The doctor comes out. He's all drugged out. We're in a recovery room, and the doctor says they think they got it. They got the area. It looks like a tree root. He drew it on a little piece of paper. And it looks like a tree root, and they got that area. And hopefully the tentacles, the roots that go out, so to speak, it'll dissipate, the seizures will stop. So meanwhile, my wife and I, we're ecstatic about this whole thing. We're thinking, could this be a cure? That's where our hope is. So we go to the recovery room. He's in ICU recovery room. And we're sitting there 3-4 hours. And of course, over 3-4 hours, he has 3 seizures in the ER, or in the recovery room. So we mentioned that to the doctor. The nurses come in, the doctor comes in, and he says that could just be kind of like an effect, kind of like just the body being used to having so many seizures over the year that it's just like I can't even think of the words, it's a kind of a apparition, so to speak. Not really an apparition, but it's just happening. The body's used to it. So apologize for that. I couldn't think of the words on that. So anyhow, he's in the hospital about 2 or 3 more days. He's kind of finally coming around. He's eating a little more. He didn't really eat a lot when he was in the hospital. I think he lost probably 5 or 10 pounds, and he was small to begin with. So anyhow, we get home, and that week we move his mattress into our room, just so we can monitor him. We kind of keep a padded cushion around his head because of the fresh, scars. His head looks, it's all different shapes on the one side. And to this day, his head's like a topographical map. You can feel valleys and, areas where the skull went back together. So over the course of a week, we monitor and we count 27 seizures over the first week home. We're devastated. Our hopes were so high. We had so much hope for all this going well. And in the meantime, the clusters start back up over the next few weeks, and we're continuing to give him diastat week after week after week. So we have a follow-up appointment with the doctor about 2 weeks later, and we tell him he had 27 seizures the first week at home. The look on our doctor's face spoke for itself. It just went numb. We were numb. He didn't know what to say. He just said, well, let's see what happens. Maybe with time, we've seen them decrease in, the numbers, and they've gotten better. Well, over the next 4, 5, 6 months, nothing changed. He just continued to stay the same. Some days he'd have more than others. Some days he wouldn't. I remember one day he had nonstop cluster seizures for 14 hours straight. So the doctors came in with the next best hope, so to speak, and they say, we have a VNS we want to do surgery on, an implant in his chest. It's a little battery pack with a wire that runs up to your vagus nerve, which is the largest nerve in your neck, and it runs up over into the brain. And the battery pack every 1 or 2 minutes will send an electrical signal up there to try to regulate his brain pattern, so to speak. So we said, what do we got to lose? There's no side effects. There's no additional drugs with it. So we say, okay, so about 5 or 6 months later, I think his first brain surgery was in May of 2011. This surgery for his first VNS was in September of 2011, if I remember correctly. So, and it was just an overnight procedure, very simple. They put the VNS into a pocket, a muscle pocket underneath or right above his left chest, left breastplate. So we had that done, and then they slowly build up the pulse, the electrical signal over the next 6 to 8 months, a year. So we don't know if there was a honeymoon period. We didn't see anything. We just knew that we were giving him Diastat on a regular basis, 2, 3, 4 times a month, and his body was building up a tolerance for this. So that's all we could do for the next few years. We didn't know what else to do. You know, they wanted to keep trying different drugs. At this point, I think, like I said earlier in one of the videos, I think we have tried probably well over 12 to 14 different medicines. We've tried, he's on Tegretol, we've tried Keppra, Depakote, Neurontin, I think Lyrica, Ativan. Well, Ativan was to stop the seizures. I can get a list of them, but we're well over 10 to 12 medicines. So at this point, we'll continue next into his second surgery. But in this whole process, you know, we're dealing with school issues. We're dealing with behavioral issues, things that are happening at school. And it's just up and down. You know, it's nonstop. And during this time also, my wife had started a seizure group with women who have children who have seizure disorders, anywhere ranging from grand mal, simple partial, Gestalt-Lennox syndrome, a lot of different types of seizures, and they would meet once a month. Well, my wife was actually they call her the pioneer in the group because she got our son onto Medicare, Medicaid, medical assistance, and it took her a long time, and she takes care of that right now, and that is a blessing to me from the Lord with her, and as far as her taking care of that, because every state we move to, that has to change. And I want to encourage parents out there that if you are having children and you're dealing with medical bills and drugs and things like that, there is help out there. There's additional help out there. It just takes time and takes a lot of paperwork and a lot of effort, but it is well worth it to get your child onto Medicare, Medicaid, disability, because that is what it's for people who can't help themselves. So with that being said, bless you all. Have a great day, and we'll talk to you soon to the next series. Thank you.